Hi, Valerie.
Hi, Juliet. Good morning.
How are you doing?
I'm doing great. How about yourself?
Doing great. Um, so going to go ahead and introduce myself. So I am Juliet Rudder. I am the Douglas County Community Engagement Coordinator with the Healthcare Coalition of Southern Oregon. This is our second live conversation of the month and another opportunity to win some fantastic prizes if y'all stick through to the end. Um, and I am here with Valerie Kelly. Um, and we are here today to talk about vaccines. So Valerie, would you please introduce yourself and tell us what you do?
All right. Good morning, everyone. My name is Valerie Kelly. I'm a registered nurse, public health nurse with the Josephine County Public Health Department. And my role here, one of the hats that I wear, the main hat that I wear is immunization vaccines in our clinics. So I'm happy to talk to you all today. And we'll see how things go. I've got a presentation that I'd like to share with you a little bit about how I greet during this COVID time, how I greet folks that are coming in with their kiddos to get immunizations. And I just would like to do a brief demonstration of how I give an immunization, how I would like the parents to hold the baby, because it's very traumatic when you have your first child and they're young, or you have a young infant of any age, of any time, whether they're your first child or your sixth. It's very hard as parents to watch our children be poked with a needle and get vaccinations. It's just a very unsettling experience because the child is a little bit of a poke, a little bit of pain, and none of us want to see our children go through any pain. We always are trying to protect them, but little pain for protection is what vaccines are about. So.
Awesome, awesome. And yeah, we super appreciate you coming to talk to us here today. And yeah, oh, and I would like to know a little bit more about who you work for and where you're at.
Okay, I work for the Josephine County Public Health Department. So we are in Grants Pass. We are at 745 Dimmick Avenue. So it is, excuse me, our health department has various services. Our WIC program is located in this building. Our Healthy Start program is located in this building. Clinic services such as vaccinations, reproductive health program for women, sexually transmitted disease prevention and treatment is available here at our clinic as well.
Awesome, awesome. Thank you so much for that background and everything. So if you would like to go into your presentation, I think we're ready.
Okay, thank you.
Yeah.
Well, here's my sweet little baby, but before we get our baby started, I just want to reassure people during this COVID time that our coming to our clinic is very, very safe. We do our vaccinations right now by appointment only, and we don't do walk-ins, so that when a person comes to our clinic, they will call first, ask for an appointment. Then we will check you at the door. Our doors are locked. We do have someone come and open the door. You're to wear your mask during COVID time. We will ask you a few of the COVID screening questions before you come in the door. And then we will take your temperature As long as you answer negative to the 3 COVID questions we have, then you can come on in and we'll take your temperature and you can wait in the waiting room. There aren't a lot of people in the waiting room where you've got you distanced 6 feet apart. And because we have appointments, we just don't have waiting rooms full of people. So I just wanted to reassure everyone that we're taking steps, COVID precautions.
Great. Thank you. Thank you.
You're welcome. And then this is my little baby Nala. And when parents come in, my baby's smiling and happy. When they see the nurse, they're still smiling and happy. But when the shots come, they're not so happy. So when I ask the parents to hold Nala, they're going to hold Nala on their lap with a young infant. And they're going to cradle them, and they're going to put their hands around baby here like this. And then we're going to use one leg at a time. And the immunizations in this young age, in the ones that aren't walking yet, we're going to use the lateral part of their leg for the injection site. So I will use the leg, the outside, what we call the lateral aspects of their legs. So if mama can make sure that they've got their onesie on, or some kind of something that we can pull down easily and not to completely undress the baby, we can do that. And then I will either hold their leg, mama will keep hold of this other loose leg and these arms, and just hold the baby tightly, not tightly, but securely, sweetly. And then I will go ahead and put the injection. I do one leg at a time, so that I do this quickly, and then I do the opposite leg very quickly as well. In older children that are walking or a little older than Nala is right now, I can use also the top parts of their legs. I can do the sides and the tops at that point. When they're older and they're walking around, a 4 or 5 year old, 3, 4 or 5 year old child, I can do in the arm, very upper arm, in each arm. If they parents prefer the legs, we can still do the legs because the legs are large muscle. We would never inject in this area, in the hip area or in the buttocks area, because of the large nerve that runs down the spinal cord and into the buttocks area. We want to avoid the nerves in that area. So we never inject into the posterior side at all.
So other than, sorry to interrupt, but I'm just curious. So other than the nerves, is there a reason why there are specific spots where you need to put in the vaccinations?
Mm-hmm. Very much so. There's only a couple of vaccinations that we do into the tissue, but most of the vaccinations are into muscle. We call that intramuscular. So we again, because these are the largest areas, surface areas, and a large muscle group in the babies and young ones, then that's why we use the legs. As they get older and more grown, then their arms do develop, and it gives me a good surface area and a good muscle to place the injections.
Okay, and is that because of blood flow, or why do you need muscle?
Muscle, you're exactly right, and so that it's got a good blood flow into the system. Right.
Okay.
Right. Now there are 2 immunizations, measles, mumps, and rubella, and varicella, that are actually injected into what we call subcutaneous tissue. So it's not deep into the muscle, it's not on the skin, but it's in that tissue area right before I go deeply into the muscle. And that's where that goes in, and then that's where the vaccine is absorbed in the tissues and gets into the circulatory system that way. Those are the 2 exceptions to the rule of intramuscular. Mm-hmm.
Thank you.
Good. Is it okay right now that we just kind of briefly talk about, I wanted to talk about measles real quick, just to give people an idea about how vaccines, measles and mumps, I gave an example of what was occurring before we had vaccinations and what is occurring at this current time.
Yeah, yeah,
Okay.
That sounds great.
The first example that I have is mumps. And before the United States started their vaccines in 1967, 186,000 cases were reported in the United States each year. Since the vaccine, the measles, mumps, rubella vaccine, which is a combination of measles and mumps and another type of measles, which they call rubella, the United States cases dropped by 99%, and we only have a few hundred cases reported for most of the years in the United States. However, we have had an uptick in measles. In 2019, 31 states reported a greater increase than they had ever had since 1982 due to people not being vaccinated. Before 1963, the measles, children got measles. By the age of 15, there were 3 to 4 million people were infected each year with measles. And 400 to 500 people died from measles each year. So that's why I'm emphasizing, those were just 2 examples. That's why I'm emphasizing the importance of vaccination. The things that we vaccinate for are, for the most part, viruses. Did that work? So we have measles, okay. Hello. Rubella, mumps, measles, mumps, rubella. We have varicella, which is chickenpox. That's a virus. We have polio, which is a virus. We have Haemophilus as a disease. We have rotavirus, which is another, again, virus. We have diphtheria, tetanus, and pertussis. Tetanus is not a virus. It's actually a bacteria that lives in the soil. And adults continue to we want to vaccinate adults as well, because we hear the old adage, if you step on a rusty nail, you better go to the doctor and get a tetanus shot. So it lives in the soil. That's why we say that. And then we have pneumonia. And we all know that pneumonia is still around, so we want to vaccinate against pneumonia as well. Then we have another virus that is bloodborne called hepatitis. And so we have hepatitis A, which is, and hepatitis B. And hepatitis A is oral and excrement. It can go through the body orally and be excreted out the intestines. We get that from maybe poor food, water conditions. We can pick it up with food that's not properly washed. Usually it's in poorly sanitized areas is Hep A. So I'm glad in the United States that most of us have clean water to eat and drink, to cook our food and drink. People as adults that are most susceptible are plumbers, naturally. Makes sense. People that do sewers and standing water. So those are the diseases that we work very hard to prevent in childhood, and then some of these continue through adulthood that we want to get our tetanus booster. And we want to continue to receive pneumonia pneumonia shot when we need it. And hepatitis A and B always are good things recommended for people, certain groups of people. Again, plumbers for Hep A, people that are working in healthcare or around blood and body fluids would be hepatitis B, that kind of thing. And based on lifestyle, people that are using IV drugs again are susceptible to Hep B as well because it's bloodborne. And then we want to keep women safe when they're pregnant by making sure these immunizations are done, especially the hepatitis B, because that can be bloodborne after the baby's born through the birthing process, the contamination of maternal and infant blood. So that's very important.
Gotcha. Yeah.
Okay. So I kind of showed you about my baby. So Nala's going to go away. I kind of talked about the diseases and I don't want to go on and on. So I'm open for questions, and I provided a schedule to you, Juliet, of any viewers or people would like to know what the infant immunization and young child immunization schedule is. That's available.
And could you talk a little bit about why we have a schedule?
Yes, we have a schedule of immunizations based on how we can get the best immunity for that particular disease, that particular virus. So we space those out at intervals. Usually we give the first vaccinations, but because of the way our immunity is, then we have to have so many doses before we get full immunity on several of them. Like the DTaP, the diphtheria, tetanus, and pertussis is 4 shots, but they're not all at once. We space them out at 2 months, and then at 4 months, and then at 6 months, and then over a year. Like when they become a year old or 18 months, we do the last one. And then at 4 to 6 year old, they get a booster when they get ready to go to school. So that's how we do it, with certain intervals till we get the full immunity that's needed.
I'm
and
actually
the kids
a little
usually go ahead, and then the kids usually get boosters right before they go to school.
Yes. Gotcha. I'm actually a little bit surprised by that answer, because most of the time I hear that, or maybe it's just me assuming that they space them out for like the child's safety or something like that. Yeah. So, I mean, is there anything to that at all, or is it really just about like what works best for immunity?
It's really about what works best for immunity.
Wow, that's really cool. And since that came up, like, so what do you do if someone doesn't want to vaccinate their child?
Okay. I would like to have a conversation with the parent. Usually they probably wouldn't even be calling to get the vaccination unless it's required for school or preschool. And then they're a little bit, if they don't want to vaccinate, then they're probably a little bit agitated that they're being required to do so. So my best bet is always education. I can't stress that enough. I would be more than willing to engage them in a conversation of where they're at, meet them where they're at, explain to me why you feel that way, what points of view have entered into that decision, and how can I help you during this time when you're feeling put upon to do this. And then I would be more than happy to answer their questions about what their fears are. what is the disease, educate them about the diseases. What are their fears in regards to vaccination? So we'd have a dialogue. We certainly would. I wouldn't come in busting doors and say, you are going to do this and here we go and bam, bam, bam. A lot of dialogue's going to go into that. I think, and I will say just a quick little blurb about this. I think there's just, because we are not seeing these diseases on a regular basis and families are not dealing with these diseases in their children, newer generations, younger than myself, I'm from the 50s generation, are not aware about how potentially serious these diseases are and what the complications are of some of them. Hospitalizations, deaths can still occur with some of these diseases. I'm going to throw polio in the mix here for a minute. Polio is a virus that affects your neurological, your nerve system and your muscles. It causes muscle weakness, muscle deterioration. So during the time before we had vaccination, you were seeing people that couldn't breathe because their muscles were so weakened they could not inhale and exhale. So we had something called iron lungs, where people were living in almost like living on a lifelong ventilator, but the iron lungs were makeshift ventilators at the time. Children that received polio were on crutches for the rest of their lives or in wheelchairs because the disease affected their, their neurological and their muscular system. So, that's an example. The other example is, I know that people are frightened of live viruses being in a vaccine. Most of our vaccines are not live viruses. They're proteins pulled out of the virus, small, minute amounts that are pulled out and processed so that the tiniest protein molecule is put into the vaccine so that the body recognizes that protein and says, okay, I'm going to make antibodies against that, so that when I recognize that again, I'm going to have my guard up. I'm going to not allow that into the body. So those are examples. I'm a survivor of the polio generation, where we all got the polio live vaccine on a sugar cube, and we all stood in line at school and got our live polio. And there wasn't any discussion about whether you should or shouldn't get it. It was pretty prevalent in the early 50s, polio. Our President Roosevelt had polio, and the residual effects of polio. So I just want people to kind of think about that and think about the history when we're talking about immunizing your children. And I would be not as a fear factor, but just to let families and young parents know that that you have to weigh the benefits versus the risks in everything that you do in life. What's going to give you, what is more risky? Getting the vaccine to your child and having a small poke, a little bit of pain at the injection site or a little bit of side effects versus a full-blown disease. And the reason why we haven't got that is because we've had a lot of people become vaccinated.
Well, I super, super appreciate your time. And I do want to ask right before we go, is there any last little thing that you would like anybody watching this to know or to keep in mind?
Okay. Yes. I just want to let parents know that you can do, I know you all are so savvy on the media and so savvy about obtaining information. I so encourage you to go to this CDC website, Centers for Disease Control website, and you can type in immunizations, and you can read all, and you can also type in just the diseases, measles, mumps, rubella. Utilize the CDC website and educate yourselves about the diseases, educate yourselves about the vaccines. And that's just a great, great resource. The American Academy of Pediatricians, ACIP, is another resource, as well as in Oregon, or the state of Oregon has a website, Oregon Health, and you can get on there and read about immunizations and look at the immunization schedules as well. So I'd encourage people to access those things that are scientifically based to make their decisions regarding vaccinations.
Great. Well, super, super appreciate that. And as promised in the beginning of this video, so in order to win your Baby 101 prizes, please comment something that you learned from our conversation today, and look forward to seeing you in the next video. All right. Thank you again, Valerie.
Thank you. It's my pleasure. Bye-bye now.
Bye.